It's my pleasure to welcome back Dr. Michael Gillette to VLGMA. Dr. Gillette is an ethics expert who has presented numerous keynotes and workshops nationally and internationally for over 25 years. Dr. Gillette graduated magna cum laude from Brandeis University with majors in philosophy and classical Greek. Earned his master's and PhD in philosophy at Brown University and has taught in several colleges and university settings, published articles in the field of applied ethics, and has received several teaching awards. He's also been elected 3 times to the City Council in Lynchburg, Virginia, and served 2 terms as the mayor of the city. Dr. Gillette contracts with dozens of healthcare organizations and other agencies and provides ethics case consultations and policy work to those folks. For those who were with us at the winter conference in Charlottesville this year, you know that you are in for a real treat with Dr. Gillette and his presentation to us on ethics. And I'd like to welcome Dr. Gillette back to VLGMA today, and we look forward to his presentation.
Good morning. Thank you for that welcome. It's a pleasure to be here this morning. Pleasure to be able to speak with all of you. Some of you probably did hear me speak back in February, and maybe some of you have heard me speak as I've come to some of your own localities to provide some sessions. And you'll know that my technique, that my style is highly interactive. Well, it's going to be challenging a little bit this morning to try to be as interactive as I'd like to be since we have gone to this online format. But as you can imagine, I've been doing a good number of these sessions over the last few months on these sorts of platforms. And if we all work together, they are quite impressive. And I'm sure that we will have the opportunity to really interact in a meaningful way. I just want to remind you that you will have the opportunity to ask questions and to engage in some back and forth discussion. The primary way that you're going to be doing that is by using the chat box. So you will all notice that there is a chat box, at least for me, it's in my lower right-hand part of the screen, and you'll be able to type your questions in there. I believe that Tim then is going to sort of collate those questions and bring them to my attention so that I can respond to any concerns that you might have. And we can entertain some back and forth via that chat box. I don't believe we'll be unmuting any of you to engage in a verbal exchange, but I'm sure that you all can type quite quickly. So hopefully that will work well. I also do want to say that while this topic does require of me that I depart from my normal style and lecture for a little bit, that is to just deliver some content to you up front, I am perfectly open to being interrupted. And Tim, I want you to listen carefully. If someone types in a question that is asking for a clarification on something that I've just said, something urgent that you feel really should not wait till the end of our time for a more open-ended question and answer period, do not be shy about interrupting me. Unmute your microphone and talk to me, and I'll stop what I'm doing and answer that question. So you will not throw me off my game, people, if you ask your questions as you go. I also do suggest that even if Tim's not going to stop me to answer a question, as the questions come to mind, it's probably a good idea to go ahead and type those into the chat box as they come to you, and Tim will be able to review those and order those, and then we'll come back to those towards the end of our time together. We are scheduled to go till noon. That's a good chunk of time on an online platform, but I am sure that we have plenty to talk about. My topic today is, of course, ethics in local government, but I thought that it might be most useful if we targeted some of the issues with which we are dealing currently. And when we set this virtual format up, I pitched the idea of calling my talk Ethics in Local Government, COVID-19 and its Aftermath. And that is what I intend to spend the lion's share of my time addressing. However, since we put this conference together, as you just heard in the opening comments, we have been now confronted with some additional challenges that also have an ethical component. Not just the pandemic, but also a national movement to talk about issues of equity and inclusion and diversity and discrimination, and in its most pointed form, discrimination in the form of how, for instance, police departments manage issues in their own communities. Those are extraordinarily important topics. They do have ethical dimensions, and I hope that we can speak about those a little bit as well. At the end of my comments this morning, I have created a series of case studies. I think I have 4 or 5 that deal with pandemic-related issues, and then I also created a couple of case studies specifically that deal with the racial tensions that we are now facing. And I, of course, am willing to flip-flop those priorities depending upon the questions that you ask. But I would like to jump right into this, and the first thing that I want to do is I would like to describe to you what the course of our conversation is going to look like. So I've broken the discussion this morning down into 4 parts. Part number 1 is understanding the ethical context. Those of you who have heard me speak before know that I am not what you would consider to be a theoretical philosopher. I am not going to bring normative ethical theories to bear in an effort to analyze the cases that we might face. I've always argued, I've always believed, continue to believe that, number 1, ethics is inherently contextual. That is, what is ethically appropriate in one circumstance is not likely to be ethically appropriate in another circumstance. So you can't actually understand ethics well, and you cannot reason to a sound ethical conclusion unless you understand the ethical question as occurring within a particular environment, within a particular context. Additionally, the way, the method, the process that we use to understand our ethical challenges and to resolve them is by analogy, by arguing from one context to another. How can we fit the current challenges that we face into a broader understanding of the moral intuitions that we have already adopted, already used, and about which there is very little controversy? So it is a very pragmatic, very practical method of ethical reasoning, and it requires first that we understand the context in which we're operating. So that's going to be part 1 of our conversation this morning. Part 2 is to pose to you a series. I came up with 15 specific ethical questions, or I should say questions that have an ethical aspect, surrounding local government's response to something like a pandemic, the COVID-19, the coronavirus pandemic that we now face. So specific questions, and I'm not going to take the time during part 2 to try to answer all those questions, because some of them are likely to be more relevant and more interesting to you than others. I want to catalog the questions, and then towards the end, during question and answer, give you an opportunity to take us back to any of the specific questions that you think are most meaningful, and we can try to analyze those in greater depth. So that will be part 2, posing the questions. Part 3 will be an effort to try to give you some material, to give you some ammunition, if you will, to start to answer some of the specific questions that we've been asking. So, as I've already mentioned in my description of part 1, I do believe that ethical argument depends upon an ability to carefully apply analogies from one circumstance to another. And so I will provide in part 3 a couple of helpful analogies that we can use in order to try to answer what feel like novel questions, but what might in fact simply be novel applications of things we've seen before. Part 4, the final part, of course, will be the opportunity for question and answer and case studies. As I said, I've created about a half a dozen case studies for you this morning, and we can take those as you wish in any order that seems most interesting to you. I'll run through them all so you know what they are, and then you can prompt me to select the most important, the most relevant. But also we can depart from my case studies and we can discuss any questions that you might have based on the material that I present, and of course, anything else that you wish to bring up. It may be a little bit clumsy in a chat box to present an entire scenario for us to consider, but I invite you to do that. So as we jump into my part one discussion here, again, I want to remind you that the chat box is there, that it's open now, that you should not hold your questions, but go ahead and enter them as they occur to you. If any of them are urgent, Tim will interrupt me, and if not, we will hold them towards the end. Very good. So let's begin with part one. If I can make my slide, there we go. Understanding the ethical context. So understanding the ethical context, part one. I want to do two things here, but the first thing I want to do is share with you what I would consider to be an ethical taxonomy of disasters. Now, this is going to be important because I believe that what we are facing right now can be characterized as a disaster. And I want to unpack that concept from an ethical perspective. So what is a disaster? What kind of a disaster do we have? I want to understand that context a little bit. So I have generated, as you see on this slide, a taxonomy of disasters. Now, I haven't defined a disaster yet, but I'm going to do that after I get through this. But I do think that it's important. And remember, I'm speaking as an ethicist. And so this taxonomy, this categorization of the different sorts of challenges that we might face is being viewed through the lens of ethics. And I think that these distinctions matter from an ethical perspective. Why would they matter from an ethical perspective? I think you'll see that depending on the type of challenge that we face, the type of disaster with which we are trying to deal, that our citizens' response, and for that matter, our response, our staff members' response, will be varied depending on the type of challenge. And I think that there are two dimensions that will alter certainly the emotional response that we have to the challenge. And that emotional response will inform a series of ethical judgments, will inform a choice of ethical responses. The two dimensions that I think matter from this ethical perspective are, number one, is this event human-caused or natural? Now, you might wonder, well, what difference does that make from an ethical perspective? Well, one particular difference is that human-induced events generally are going to trigger a greater sense of responsibility, or at least a desire to assign responsibility for all of the bad things that are happening. We will have a focus. There will be blame. We will need to respond to claims of blame. So that will alter the nature of the relationship between victims of the disaster and people who are trying to assist those individuals. So whether or not this is a natural disaster that somehow we could not have prevented or could not reasonably be expected to have prevented, or this is a human-induced event that we either caused directly or that we should have, in order to avoid being negligent, prepared for and avoided, that's going to make a big difference as to how people interact with one another and what they ethically expect from one another. So that's dimension number one, human-caused versus natural. Dimension number two that I think is very important to keep in mind as we understand disasters from an ethical perspective is whether or not the event is discrete or extended. Now, discrete could have two components. A discrete event is limited both in time and in space. So a discrete event, a purely discrete event, would be an event where we know when it begins, we know when it's going on, and we know when it ends. We also know that it is striking a limited, targetable geographic location. There are boundaries to the event to which we are responding, as opposed to an extended event, which could be extended either in place or in time. We don't know what the boundaries are. We don't know what the ripple effects might be. We don't know where we are in the course of the event. We don't know when this is going to end. Now, notice that extended events are likely to cause much greater levels of unease. It is much more difficult to focus ourselves on a response when we're not sure where we're supposed to respond, we're not sure how long our response is going to take. This is going to create a lot of discomfort, a lot more discomfort than a discrete event where we can say, yes, that was bad, but it had a beginning, a middle, and an end. It's over. We now know it's over. We know who the victims are. We can concentrate our response on those individuals. We know where to allocate our resources, which is an ethical issue. So I would argue that in order to manage a response properly from an ethical perspective, it's extremely important to immediately understand what people are feeling about the challenges they face. Is this human caused or is this natural? Is this discrete or is this extended? With those two dimensions, we get at least 5 different possible categories of disaster. Type 1, a human-caused discrete event. Okay, so it's definitely something where we can assign blame to a particular set of individuals. We definitely know where it is and when it is. A good example of that would be the terrorist attacks on 9/11. These clearly were devastating. So this is not to suggest that man-made discrete events are somehow less important than other types, or that they are less devastating, but nevertheless, they will create a particular type of moral intuition, a particular type of ethical response. So 9/11 would be a good example of a human-caused event that was quite discrete. Although I will note that while it was going on, that is on 9/11 itself, notice how uneasy we were when we did not realize that this was a discrete event. We didn't know how many other planes might still be in the air. So if you recall how we felt in the hours and the days, and even to some degree the weeks, but mostly just days after the attack, where we didn't know if another shoe was going to drop, notice how that changed our emotional management of the situation. Type 2 disaster, still human-caused, but extended. And after 9/11, we were concerned that there might be a follow-up attack that was a bioterrorist attack, a smallpox attack, an anthrax attack. Still human-caused, so our concepts of responsibility and blame are still intact, but we weren't sure where we were going to get hit, or if we were going to get hit, or when we were going to get hit. That would be an example of a man-made extended event. Third type of event would be a natural discrete event. So this is not human caused, and so our sense of responsibility might be slightly altered here, but it's very discrete. We know where it is, we know when it is. And the best example of that, or a good example of that, would be Hurricane Katrina. You might be upset with the lingering impacts as we don't necessarily respond as quickly as we should, but nevertheless, we know when the hurricane hit, we know when the hurricane dissipated, we know where the damage was done. That's an example of a natural discrete event. Compare that to type number 4, a natural extended event. That's what we're in right now, although there are some conspiracy theories out there that suggest that this is actually a human-caused extended event. I have not seen any evidence to indicate that any human being intentionally infected the world with the COVID-19 virus. I'm willing to categorize this as a natural event that is extended. And by the way, I think that the 1918 influenza is a great example of this. And of course, our current coronavirus situation, novel coronavirus situation, is also a good example of this. And I believe this is the granddaddy of all disasters. This is the one that could extinguish our society as we know it. If this gets as bad as 1918, I'm not sure that we will truly survive it in anything like our typical political structures. We haven't gotten there yet. Hopefully we won't get there. We shall see. But that's a natural event that is not limited in time, not limited in space. If we have those 4 combinations of these 2 dimensions, then obviously we could also have a hybrid. We could have some combination of these 4 different types of events, and that gives us a 5th category, what I'll call a mixed category. And this could be mixed in a number of different ways. But a good example of a mixed event would be the Fukushima nuclear experience in Japan. There was a natural discrete event that triggered this. It was an earthquake under the sea, causing a tsunami that then overran a nuclear power plant, which then generated a human-caused, because nuclear power was human-created, a human-caused extended event. We didn't know how long the radiation would leak. We did not know how far the impact would be. So you had a mixed event there, something that started as a natural discrete event and then transformed itself into a human-caused extended event. Now, why does any of this matter? I've just spent, 10 minutes talking about this. I've told you a little bit about how this impacts our emotions, but I want to talk a little bit more about disasters itself, because I do not believe that disasters are just scary situations, or that disasters are just sad circumstances, or even that disasters are just situations in which a lot of people die. A lot of people die every day. A lot of people die all the time. It is sad. When we can avoid it, we should, but it is not true that every death is a disaster. Disaster, in my vocabulary, in order to get to the ethics of this, I want to use the term disaster in a much more precise way, in a much more specific fashion. So I want to introduce you to a concept, an ethical concept. This is vocabulary that in normal language, that everyday conversation might use this sort of language, but you probably use it in a way that is a little bit imprecise. And for philosophers, the concept of a moral dilemma actually has a very technical meaning. A moral dilemma is not just an uncomfortable situation. A moral dilemma is not just a situation where you are forced to do things that, well, you wish you didn't have to do. This is an uncomfortable choice. This is tough. We call that a moral bind, if you will, where you feel as though you're under some pressure. But a moral dilemma is something much more important. A moral dilemma, if we're going to use the term carefully, is a situation in which you simultaneously maintain multiple moral obligations, and those obligations are contradictory, which means that satisfying one ethical obligation automatically, by definition, requires that you fail to satisfy another ethical obligation. So you have an ethical obligation to do A, you have an ethical obligation to do B, but A and B are inconsistent. There's no logistical way that you can find to satisfy both A and B simultaneously. If you do A, you automatically fail to do B. If you do B, you automatically fail to do A, which means no matter what you do, and by the way, you have an obligation to do A and an obligation to do B, so failure to do either or both is a failure to satisfy your moral obligations, which means you're doing something wrong. So you can't just throw your hands up and say, that's it. If I can't do both, I'm going to do neither, because that also would be a failing. In fact, it would be a double failing. So you find yourself trapped in a situation where no matter what you do, you will do something wrong. You cannot help but do something wrong. This is different than just doing something that's uncomfortable. This is actually doing something wrong. Now, what I want to argue, and so let me read this slide. A moral dilemma is defined as a situation in which the existence of contradictory obligations results in the inability to avoid doing wrong. The inability to avoid doing wrong. Now, I just need to say, first of all, I'm going to use this concept of moral dilemma to define a disaster. So a disaster is not just a really sad situation. A disaster is not just a really tough choice. A disaster is a situation where you are driven to such an extreme that you believe that you can't help but do something wrong. You have to make a choice. You're a leader. People are depending on you. You're going to have to make decisions, but you cannot find a way to avoid doing something immoral. That's from an ethicist perspective. I mean, from someone who studies morality for a living, that's a disaster. That is an intractable ethical problem. Now, before I move to the next slide, I want to say that there are a good number of philosophers, and I actually think I count myself among these, who do not believe in moral dilemmas. I don't really believe in a moral dilemma, because what I would argue is that in any circumstance where there is a contradiction between moral obligations, it is possible to prioritize the ethical obligations so that one will take precedence over the other. Let me give you an example. Suppose I am lost in the wilderness. I went hiking one day. I thought I knew where I was going. I'm an experienced hiker, and I usually carry a map and compass or whatever. But you know what? I didn't, and now I'm lost. And I got turned around, and I've been trudging through the forest now for 3 days. I don't have any granola bars left. I haven't eaten now in 2 days. I have very, very little water. I've drunk everything that I brought with me. I found a little bit of water here or there, but I am on my last legs. I am clearly getting very, very weak. I am about to die. I know this is it. I can't get unlost, and I am in deep, deep, deep trouble. And just as I'm about to give up hope, I sort of peek through the woods, and what do I see up ahead? There's a hunting cabin. And I'm elated. Oh, maybe this is my salvation. So I run to the hunting cabin, and I go to open the door, but it's locked up tight for the season. It's completely locked. But I peer through the window, and on the back wall of the hunting cabin is an array of canned food. There's all of this food right there. And lucky for me, right on the counter, there's a can opener. All I have to do is get to it, and my life will be saved. But the cabin is locked, and it's not mine. This is private property. The only way I'm going to be able to save my life is by breaking the window and stealing the food. It will be theft. I will steal property that does not belong to me. What ought I to do? Many would argue, wow, that's a moral dilemma. You have an ethical obligation based on your right to life to save your life. You have an ethical obligation not to steal based on respect for other people's autonomy rights and their private property. You cannot satisfy both of those at the same time. Bingo, you're in a moral dilemma. And what I would argue is, no, you're not. No, you're not. Because the right to life is a more powerful right. It takes precedence over the right to property. And so the right to life is sufficient to justify overriding somebody else's right to private property. Now, if you steal that food, it may trigger some secondary ethical obligations that you have. You'll have to make restitution. You'll have to fix the window. You'll have to replace the food. You might even have to pay damages, right? You'll have to accept responsibility for the choice that you made to save your life. Nevertheless, what we could argue is effectively it was self-defense. I had no choice. It was the law of necessity, and therefore stealing was actually the ethically right thing to do in that case. So this is a debate that's in philosophy. Do moral dilemmas actually exist or not? But for our purposes today, we're not going to settle that debate. I simply want to say this. I want to ask this. How do we define a disaster in ethical terms? And my answer, because I'm speaking to you as an ethicist, is that what makes something more than just a sad situation or a challenging situation or a difficult situation, what really transforms it from being tough to being a disaster is that we feel pressed to make decisions that we believe are wrong. Now, if you believe in moral dilemmas, you're golden. If you don't believe in moral dilemmas, if you're like me, you still can see how this would be a disaster. Because on a typical day, I would never agree to X. X feels wrong to me. I don't want to do X because of an ethical commitment that I have made. And yet now I am being pushed to do X. That's what makes this a disaster. The fact that we are going to have to make decisions that not only will we struggle with, but when it's over, we will regret. We will feel badly about them. We will lay up at night wondering if we did the right thing. You know, I'm talking to you guys in local government right now, but I have to tell you, the lion's share of my work is in clinical ethics. And I've helped policy writers now in these various hospitals. I have been on the teams that have now developed policies on triage for ventilators. Now, we have dealt with allocation of scarce resources for decades. That's not new. You have two people who need a resource. You only have one of the resource in question. Who should get the next available slot? All right, we've dealt with that in local government. We've dealt with that in the hospitals. We know how to do that. We get pushed now with the pandemic, not to just asking who gets the next ventilator if multiple people need it. We now get pushed to, are we going to extubate someone? Are we going to take someone off of a ventilator in order to liberate that resource for someone new who comes through the door? That is unique. That is new. That is something we never would have considered before. We know that people die on the wait list for kidney transplants, and we make decisions about who gets the next kidney. We never consider forcibly withdrawing a kidney from one person in order to give it to somebody else. And yet that's precisely what the COVID-19 experience has forced us to consider. That's a disaster, a moral disaster. That's what we need to take seriously. So once we understand that we're in the context of a disaster, we understand sort of what the disaster is, what kinds of ethical issues do we need to worry about? I'm going to give you some broad categories, and then I'm going to jump into the specific questions that I have prepared for you today. There are I think that there are 5 broad categories of issues that you need to consider, and they're interrelated. Category number 1, allocation issues. This may not be something that local governments deal with in the way that news stations would like to think we would, but we will. There will be some hidden ways that this first issue of allocation comes out. Right now, everybody's worried about, all right, how do we triage medical resources? Who should get the ventilators? Who should get the trials on the new medications? How are we going to determine who gets the vaccine when it comes into production and we don't have enough for everybody? All right, that's what the news stations are all worried about. But of course, you all know as local leaders that the pandemic experience is triggering not just a health risk to our communities, but has triggered a significant economic downturn. And we, as local leaders, I shouldn't say we, I apologize. I used to serve on council. For those of you who don't know me, by the way, I was on Lynchburg City Council for 12 years. I was mayor of the city for 4 years. I am bringing to you not only my experience as an ethicist, but also some insight as to how local government actually works. So forgive me for slipping back into the we talk. I've been off council now for about 4 years. By the way, I chose not to run again. I was not voted out of office. So I just want to make sure everyone understands I've won every election in which I have run. That is a digression. Back to number 1, allocation decisions. Our budgets are going to be shredded. Our meals tax revenue has plummeted. Our lodging tax revenue is non-existent. Some localities may have even decided to give some relief. You have delayed maybe business tax bills. You have delayed, I don't know, real estate tax bills. Or done something else to try to mitigate some of the harms that people are experiencing. That's going to require an allocation decision. We're going to have a shortage of resources. We're going to have to reprioritize where those resources go. That's ethical issue number 1 that's going to come out of this. Ethical issue number 2, broad categories, liberty issues. These are going to deal mostly with citizenry, the general populace. You'll notice that category 3 will flip that around, but let's take category 2, which I will call liberty type 1 issues. To what degree, and this is not really, especially in a Dillon rule state, something that as a local governing body you can control, but on the federal level, on the state level, and then of course we're going to have to carry out some of those decisions that are made, and we might have some freedom on some local level to talk about quarantine, isolation, business closure. How are we going to enforce regulations, for instance, that the governor might put in place about I hate saying social distancing. I think it's a really bad term. I think it has ethical implications that are dangerous. I wish that whoever was the first person to speak talked about physical distancing rather than social distancing. That's another issue, by the way, when we start to reopen, we're going to have to think about. We'll get to that later. Disparate impacts of isolation on different demographics within your society and whether or not we're going to use resources to try to mitigate those harms. Social distancing is dangerous. Physical distancing is necessary. What can we do to maintain social contact even at a time when we're physically distant? Nevertheless, questions of type 2 here are going to be, to what degree is it ethical for us to try to control people's behavior in order to stop the spread, the contagion of the illness? That then spills into our category 3, liberty type 2 issues. The only difference between liberty type 1 and liberty type 2 is that what I do in liberty type 1 is concentrate mostly on the general population. And in liberty type 2, I want to talk about our responsibilities as providers of services. So this is now staff oriented. To what degree do staff members have an ethical obligation to stay on post? Do they have the ability to refuse to engage in hazardous duty, hazardous meaning infectious, where the risk of contagion is higher? Can we, if we have a shortage of staff, we've had to furlough people, or a lot of our staff are out sick, can we press some people into service in areas that are outside their normal areas of expertise? So how much flexibility can we demand from our staff people? Those are liberty questions because they affect the freedom of the individual, but they're staff-oriented rather than, say, population-oriented. Category number 4 of issues, fairness issues. These are gonna follow right on the liberty type 2 issues. When we start managing our staff in the event of a pandemic, how are we going to distribute risk amongst them? Who gets to work from home in a relatively safe environment? Who has to show up? Who has to do face-to-face work with citizens? How are we going to manage those interactions? Do we distribute that risk evenly? Do I say, look, everybody in the department has to take their fair turn going face-to-face, working with individuals from the community who refuse to wear masks? Does everybody have to take, I mean, you had an 8-hour shift where you were getting breathed on all day. Do I now say, okay, you get tomorrow to be in the back office, and someone from the back office now has to take the front end brunt of the risk? Or is it more ethical to say, look, you've already been exposed, so let's leave you in that position. Let's keep some other staff members sequestered so that when you get sick, we have someone else to put in your place. What's the right way to sort of triage that risk, to distribute risk amongst staff members? And then finally, number 5, I know I've been talking for a while here. I haven't even gotten to our questions yet. But number 5, public coordination. Now, I've got to say something about this. I wrote this slide 13 years ago. I was first asked to help develop an ethical analysis of pandemic preparations back in 2007. We had already known about SARS and MERS. I think H1N1 was maybe still on the horizon back then. Don't remember the exact dates. But I started working on ethical issues in responding to pandemics 13 years ago. I want to point that out, because if anyone tells you we couldn't have seen this coming, no one could have possibly prepared for this, this is one of those, bolts of lightning out of the blue, they're either lying or they're ignorant. We definitely saw this coming. We knew that this was a serious possibility, and we were preparing for it. We did not prepare for it well enough, but it's easy to push aside things that seem like, yeah, if they happen, it'll be on someone else's watch, and ignore the risk today. The reason I tell you that I wrote this slide in 2007 is because when I wrote it, number 5, I wasn't sure if I should put it on the list. And when I put it on the list, I thought, well, gee, maybe I should put it at the bottom of the slide. Maybe it shouldn't be up there with the other 4. Public coordination is a pragmatic issue. It's a practical issue. There's really not much ethics to it. It's just a question of understanding the chain of command and following it. So public coordination, maybe there's some ethical issues, but they're minor. Let's put that in its own little subsidiary category. Based on our current experience, this is back on the list, and it's back on the list right up with the rest of them. We have seen in our country a failure, not a complete failure. I do not want to overstate this. I don't want to point fingers in any particular direction, so I don't want to say we have failed miserably, but I think we have come up short and public coordination. Who's making decisions? Is it the federal government that decides when things open and close? Is it the states that decide that? Is it regions, sort of consortia of states? Is it a locality? Is it a particular locality or even a subdivision of a state? Where do we get our marching orders? Who's in charge of what? Put this just on a local level. I guarantee you, and I don't want to offend anyone because I know you're probably listening right now. I guarantee you that there is, well, I hope this is not true. I hope that there is great clarity in my own community about whether or not the local hospital could seize the high school gym as a triage center if it needed it. My guess is that the CEO of the local hospital believes that if he needs the gym, he can take the gym. I'll bet you the superintendent of schools says, no, that's my territory. I bet she thinks that she gets the green to green light the use of her gym. I'll bet you that the city manager says, no. In our locality, at least the schools are the school buildings are the property of the city. City manager gets to decide how those resources will be used. And I'll bet the police chief thinks that it all depends on whether or not the police chief determines that there's a state of emergency here, advising the city manager who goes to council, where council has to make the decision, ... My point is this. Do we really know who's calling the shots? Do we really know what our roles are, how our individual roles relate to the roles of other people, what the reasonable expectations are for our behavior so that we know whether or not we are satisfying the expectations of our role, and whether or not we are committed to maintaining a proper structure of coordinated control. I know that all of your communities have emergency plans in place and that you have drilled on this and thought about this and argued about this. And I am just hoping that your local plans work more smoothly than what we have seen coming out of the Fed and what we've seen coming out of the state. And I would even say departments within state government. Has the health department been clear enough to the Department of Behavioral Health and Developmental Services about what's expected of them? I'm getting consults from facilities, state facilities, all across the state saying, we're not sure if we're supposed to cooperate with one another or compete for resources. Public coordination. All right, I desperately need to move on because, as you can tell, even though
Dr. Gillette, this is Tim.
Yes.
We do have several questions that come in. It might be a good time to address a few of these based on the material that you've already went over.
Sure, absolutely. Hit me with some good questions.
So I've got 4 questions so far. The first one is, how do we balance our moral obligation to not seek funds for needs we don't have against our obligation to obtain for our community all legal revenues being made available?
Huh. Wow. I'm going to read that again because that is a great question. How do we balance our moral obligation to not seek funds for needs we don't have against our obligation to obtain for our community all legal revenues being made available? This is a wonderful question, and my counter question would be to press a little bit on this notion that you are seeking funds for needs that you don't actually have. Now, there is going to be a difference, an important ethical difference, between fraud, which is claiming to have a need that you don't have in order to draw down resources that are available to you, versus careful planning for the future, which is anticipating needs that you reasonably believe you are likely to have moving forward. So I would, the person who asked that question, I think it was Dean, I would have to know a little bit more about what you're asking about. So for instance, if you're saying, the CARES Act goes into effect and it says we can get money for payroll. Right now we got plenty of money for payroll, but we're missing money for something else. And so what I'd like to do is get the money for payroll through the PPP or the CARES Act. And then what I'm going to do is I'm going to use that to supplant resources that are squishy in my budget. They're fungible, and I'll use those fungible dollars to do something else. And so it's a shell game. Is that unethical? Is that fraud? Or do you honestly believe that given the structure of the budget, you are going to face shortages in the very areas that those funds are meant to support, such that all you're really doing is being proactive. All you're really doing is being more anticipatory in the needs that you make. Now, what I would argue is, if you, in your heart of hearts, know you don't need the money for what the money is explicitly earmarked to perform, then it is unethical to ask for that money. That does not mean, listen carefully, that does not mean that you shouldn't ask for the money just because you could probably figure out a way to get by without it. See, the word that's so important here in your question is need. And what you've asked is, if I don't really need the money, should I ask for it? I want to dig deeper on the word need. If what you're telling me is, I have enough flexibility in my budget that I could find a way to cover expense X, so I don't really need the federal dollars to cover X. Careful. If you are having trouble covering X, and the federal dollars are designed to help you cover X, then the mere fact that you could have found another way to cover X without using the federal dollars does not mean that you don't need the federal dollars. It means that you're a clever, intelligent budgeter who will find a way. But finding a way is going to mean cutting other programs. It is not unethical for you to say, in the current circumstance, we have a shortfall for X. The federal government has given us resources, or the state government has given us resources to do X. I'm going to seize that opportunity so that I don't need to raid the budget elsewhere. I don't believe that is unethical. I don't believe that is fraud. Because they're not asking you to apply for the money only if there is absolutely no other way that you could figure out how to meet that need. What they're asking you is, will you be using this money to supplant lost resources that would have been used to meet that need? And if the answer to that question is yes, I don't think it's unethical to do it. I don't know, Dean, if you want to type back. Remember, I love to argue, and I'm happy to admit that I'm wrong. So you're saying the need existed before C-19 and regardless of C-19, distance learning and teleworking. Listen, I don't think the timing is what matters, because I don't think that these programs are basically saying you must restrict your analysis of need to tightly connecting this shortage with this expenditure, this failure to collect revenues with this expenditure, and prove to me. I mean, look, if the program says you need to prove to me that what you've lost are resources that would have been used for this, and now you don't have, then you need to be honest. I mean, you cannot lie in your application for these grant funds. So if the grant is written in such a way that says, demonstrate to me that you had $1 in this line item and that you lost that dollar because of a certain experience, and we will be happy to refill that dollar. If that's what it's saying, you need to stick to the letter of that law. But if what it's saying is, we understand that local budgets are now under extraordinary stress because of the loss of tax revenues. Because of the loss of tax revenues, you are going to have a hard time meeting expenses of type X, and therefore we are offering resources to help you meet expenses of type X in or during the period of this downturn. I think there's enough squishy room there that you're not being unethical when you use those funds. You do not need to exhaust, that is to drain, line items out of every other part of the budget and reallocate them to purpose X and fail before you can legitimately access these resources. Yeah, I see. Feds sent funds to the Commonwealth, and Commonwealth sent to locality. We didn't apply for the grant funds. Yes, don't worry too much on whether you apply for the grant funds, because the funds are being provided to you with strings attached. My only point here is that whatever strings are attached to the dollars are strings that you need to honor. But that does not mean you need to go out of your way in order to generate for yourself new strings that they didn't put on you. I don't think it's unethical to look. This is not a new question. All right, this is not unique. The reason it's not unique is that you guys constantly get funding through various sources, where the grants that you get, the programs that you apply for, however those funding sources come to you, place limitations on how you can use those funds. And very often they talk about not replacing or supplanting existing funding. That is common and routine. And you know that if you play funky little games in your budget to make it look like you're not supplanting pre-existing funds, but actually you are, then you're lying. And you've done something unethical, and you shouldn't get that money, and you should get in trouble. You should get fired, you should go to jail, whatever. That's wrong. But that does not mean that when you get those funds that have strings attached, that somehow you should only use that money if there was no other way you could have funded the expenditure that you want to fund. I remember when I was on council, applying for, firefighters to get new fire trucks or to hire 3 new firefighters, and the money would come from the state and it would say, look, it can't replace or supplant. So what you can't do is you actually have to hire 3 new people. And then when the grant runs out in 3 years, you can't then just fire 3 people and have this be a shell game. This creates grant crack. There are times in which you should just say no to the funding. You should just refuse the funding, because the funding constrains your behavior in ways that actually cost you more money than it saves you. That's grant crack. Don't take money just because it's there. Only take money when you can legitimately use it in a way that extends the goals of your activity, when the interests of your locality can actually be enhanced by accepting the money. If this will be value added, take the money. If it won't, don't. And that's all going to hinge on what the strings specifically say. So I would encourage you to think creatively. I would encourage you to think openly. I would encourage you to play with your budgets in ways that allow you to maximize the impact of the resources you can get. But you have to be honest about what you're doing. You can't lie. And if the funding sources say, I'm sorry, that's not what this was intended for, then don't take the money. Tim, is there another question you want me to get to now?
Yeah, there's another question. Would you agree that politicians and the media have become very good at turning natural disasters into mixed events? Katrina was a natural, but also a failure of the Corps engineers and the result of a man-made global warming.
Man, do I love that question. Yes, I agree with you entirely. And this has serious ethical implications and serious political implications. Why would we have any urge whatsoever to convert a natural disaster into a human-caused disaster? In many ways, a natural disaster from an ethical perspective is easier to manage. Okay? From an ethical perspective, I have to give you an example. People are willing to be told no. They're willing to be told no much more easily if they feel that the no has come not based on an intentional judgment of their value as human beings, not because someone decided who should get or who should not get, but based on some randomness in the universe. It was first come, first served. It was the luck of the draw. People are willing to accept significant burdens if they feel that, you know what, that's just life. Life's not fair. But as soon as someone is able to say, wait a minute, why did you do that to me? Why did you do that to me? That changes the entire structure. They are much less willing to accept that burden. They are much more eager to see restitution. They are going to press the issue much, 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 much harder. Why would anybody want to take a natural disaster where the initial urge would be to pull together and to recognize that the inequality of the impact is not something that we can control, and that we're all in this together, and that it's luck of the draw, and we just need, actually a natural disaster almost encourages cooperation. Why would we convert that into a human-caused disaster? Well, the answer is easy. The answer is easy to see. Because it fires people up. Because it allows us to assign blame, because it gives us the opportunity to make somebody the bad guy. And who is the bad guy going to be? Our opponents. The bad guy is always going to be the other, so that I can consolidate my power, consolidate my influence, that I can direct the venting of frustration in a direction that helps me with my political agenda. I love your question, and I believe that every actor, that both major political parties are guilty of this. That the Democrats want to do nothing but talk about how Trump fired the scientist who was supposed to be in China and following pandemics, and that he had been warned not to do it, and that therefore everything that happened thereafter is Trump's fault. That's a great story to tell if you want to consolidate your position as a Democrat. And the Republicans want to argue, wait a minute, Obama's the one who didn't supply the N95 masks and the ventilators and made all those budget cuts. And worse than that, it's those Democratic governors who are unwilling to make the hard decisions that need to be made in order to stem the tide, right? Or it's a Democratic hoax. This whole thing is being blown out of proportion. This is no worse than the flu. It's being blown out of proportion by the Democrats who want to make us look bad. Look, both sides are making claims against the other. And you know what? Maybe this is a mixed event that we're facing, like Fukushima, because the pandemic itself is natural. But you certainly can point all along the way to balls dropped that have made this worse. But I also should point out, it's always hard to prove a negative, but this could have been and should have been and would have been by orders of magnitude worse than it has been had federal, state, regional, local governments not come together the way that they have, and forget governments, people, to stay at home, to wear PPE, to avoid unnecessary gatherings. We have sheltered in a way that has saved many, many, many lives. We're much more likely to hear stories about how many people are dying as opposed to how many people are being saved. And that is politically driven. I share your frustration at that. If I were a leader still in local government, I think that I would do everything I could possibly do right now to reinforce the message of our collective effort and the successes that it has brought to bear, because I think that's a story that needs to be told. Tim, anything else before I move forward?
Maybe just one more, and in the need of time, we'll catch the others a little bit later. But there's one here in regards to a moral dilemma. Is that the same as the needs of many outweigh the needs of a few, or vice versa?
We have a Star Trek fan out there, someone who loved to hear Spock tutor Captain Kirk by saying the needs of the many outweigh the needs of the few. And of course, if you got to the end of the Wrath of Khan, the quote ends, or the one. So the idea here is what we refer to as consequentialism. Many of you might think of utilitarianism. If you took an intro to ethics course, utilitarianism is actually one particular version of a broader set of ethical theories known as consequentialist theories. And the consequentialist theories are the ones that say that the moral value of an action is a function of the outcome, the consequences of the action. So if you bring about a good result, you've done the right thing. If you bring about a bad result, you've done the wrong thing. By the way, this is in direct contradiction from deontological theories, people like Immanuel Kant and any other rights theorists, who argue that no, you can do some things that are wrong even if they end up bringing about a good outcome. So you cannot reduce the good, you cannot reduce the right to the good. It's not true that the right thing is always defined by good outcomes. Sometimes there are things that it's wrong to do just because they're wrong, even if they would lead to good outcomes. So that's a big debate in philosophy. The force of the question is a moral dilemma, how does a moral dilemma, or the concept of moral dilemma, relate to this idea that the needs of the many outweigh the needs of the few? In truth, I will tell you that consequentialists, utilitarians, people like John Stuart Mill, they're precisely the philosophers who do not believe in moral dilemmas. Because what they will argue is that if you're a true consequentialist, you can always do your moral calculus. You can always add in the advantages of a particular point of view, subtract out the disadvantages. Do that with your other alternatives. Add in the advantages, subtract out your disadvantages, and then you can compare which of all of your options has the greatest balance of advantages over disadvantages. And according to the consequentialist, that is what you are ethically required to do. And a good consequentialist would argue, therefore, there cannot be a moral dilemma, because either it will always be the case that one from among your array of options always has a greater net benefit over harm ratio. The cost-benefit analysis clearly shows that this option is preferable to all the others. Or if you find yourself in a situation where you have a dead-on even set of choices, where you have two or more options, where you cannot distinguish that one is preferable to another, then the consequences of doing nothing, that is choosing no option, are worse than the consequences of choosing an option randomly, which means you then have an ethical obligation to randomly choose from among the equal options. So you have a moral obligation to choose in some way, and it could even be roll of the dice. So a consequentialist is going to argue there are no moral dilemmas. Now, what I want to say about that is two things. Number one, even if I agree with that, and by the way, I have to give you a hint here. Even though I don't believe in moral dilemmas, I'm not a consequentialist. I do believe that there are some things that are unethical, period. Not to be determined by how good or bad the consequences are. There are some guardrails on our moral behavior, period, forget moral. The guardrails are the morals. So there are guardrails on our behavior that prevent us from doing certain things, even if in the long run, those things would produce greater good than harm. Okay, so I'm not a consequentialist. All that I want to tell you is whatever theoretical commitments you make, whether you are a consequentialist or a deontologist, or later we'll talk about a virtue theorist, whatever it might be, what categorize our current circumstances as a disaster is that you are going to be forced to make decisions that up until this point you would have rejected out of hand as being ethically untenable. You are going to cut people off from services. You are going to reprioritize what you do with your budgets in ways that are going to be very painful, that you would never have considered before. And when it's over, you're going to ask yourself, did I do the right thing? I feel awful about this. I have a feeling in the pit of my stomach that I am a bad person. You are going to experience trauma. Maybe that's a better way to talk about a disaster, is that it's moral trauma, it's moral injury. When it's over, you're not going to be sure if you're a good person. That is serious. What I can tell you is that you are a rational, thoroughgoing, Spock-like consequentialist. You'll have an easier time recovering from your moral injury when this is over, because you will believe yourself when you tell yourself, I did the best that I could in a bad situation. If you are not a Spock-like, logic-driven consequentialist, you're going to have deeper moral injury. You're going to feel worse about it when it's over. You're going to have more sleepless nights. What I hope this talk does more than anything, one goal of this talk would be to prepare you for the aftermath. If you understand going into this that what you're facing is a moral dilemma, or if you don't believe in them, a serious moral bind, and that you are going to have regrets when it's over, then when it's over, you will at least be able to remember that you went in with your eyes wide open, you knew what the risks were going to be, you had the courage not to shy away from the challenge, you knew that you were going to feel pain as a result of the decisions, but you knew those decisions needed to be made anyway, and that you did the best you could possibly have done. And even if later, in retrospect, maybe when new information comes to light, you end up feeling, damn it, I wish I knew that at the time because I would have made a different decision. By thinking about it in advance, by having this conversation now, I'm hoping at least to inoculate you a little bit to those feelings of doubt later, because you'll be able to say, I really did think carefully about this. I did not go into this frivolously. I really honestly knew that I was making serious ethical decisions, and I did the best I could. And we all make mistakes, or we all have the benefit of 20/20 hindsight. So I can't read backwards in time and think that I knew something I didn't know at the time. I trust myself that I did the best I could. I think that's going to be hugely important when you come out from under this. All right, I think Tim wants me to move forward because, man, I was a little worried we weren't going to have enough material for 2 hours. Let's keep moving because I do want to get to these questions and analogies, and then share with you even some cases, and then we can take it from there. So I have 15 questions. Some of these, as I say again, especially in a Dillon rule state, might be things that are outside of our purview, but there's still things we need to be attentive to, especially to the degree that we can lobby for those at different levels of government to handle in a specific way. So I'm just going to run through these 15 questions and try not to editorialize too much. Number one, who should be in charge of coordinated response efforts? It's the coordination question. I think you get it. 2, under what conditions are mandatory quarantines ethical? 3, under what conditions are mandatory business closures ethical? And again, I understand you can't control all of this, but these are questions that you certainly deserve to have an opinion about. 4, is it ethical forcibly to commandeer private or public business or educational infrastructure and other resources? This is the can I grab the high school gym as a trauma center for my local hospital? 5, is unconsented surveillance of potential contagion ethical? This is actually going to be an interesting question. When I was on council, I remember getting into a debate about police officers using a new technology that automatically recorded license plates. And it was not something that was intentional, where a police officer would see something suspicious and make a note. This was the camera on the car being equipped with software that was able to recognize license plates and store this information for some period of time. So you're just driving out. It's publicly observable. You're not breaking into people's houses. You're not, nothing you need a search warrant for, whether you're out on the road driving your car or something that any reasonable person could see. Is it ethical for the police to record those license plates? You are not a suspect of any crime. You are not being investigated. Some people argued, hey, it's publicly observable, no problem. I'm not so sure about that. The police wanted to do it because they said, look, then if we get a crime, say in a neighborhood, we can go back the next 3 days and find out who was there. Maybe we'll catch a lead. Unless people really understand that they're being surveilled in that way, I think there are some privacy issues here. And I argued vociferously about that in terms of how we were going to collect the data, how we were going to store the data, how we were going to use the data, how long we were going to retain the data. Those are serious, serious ethical questions. I think we're going to face a lot of those questions when it comes to COVID-19. If we have drones flying around with infrared cameras that can read your temperature, is that an ethical thing to do to sort of determine how many people shuffling about the local park are at risk of infecting others? It's an interesting question. 6, may staff members refuse to come to work? You've already dealt with this. We can talk about it more if you like, but do they have the right to say, this is too risky, I don't want to be there? 7, do staff members have a right to refuse to provide services to high-risk individuals? What are you going to do when you start reopening a lot of programs and some of your citizens refuse to use PPE, refuse to stand 6 feet back from the counter? Do your staff members have a right to say, look, I'm more than willing to come to work, but I am not putting up with that? 8, should management of dangerous staffing assignments take place to reduce the risk of contagion, or should all staff members take their turn? That's the triage, the distribution of risk question from before. 9, should staff who have elevated risk factors be excused from hazardous duty? You can answer question number 6 in a couple of ways. You can say, you don't want to come to work, don't come to work. You could say, no, I declare you essential. I require that you come to work. If you don't come to work, disciplinary action. You could also now combine question 6 with question 9 and say, you know what, you have to come to work unless you can tell me a special story. If you are over the age of 65 and or you have immunocompromised status, then you will get an exemption to the requirement that your colleagues will not get. So it's a good question. And it leads to question number 10, should staff members' family situation impact staffing decisions? I am not immunocompromised, but I am by necessity the sole care provider for someone in my household who is immunocompromised, and therefore I request an accommodation on behalf of my dependent family member. Let's move on. 11, do any particular staffing assignments exempt an employee from hazardous duty? In other words, are there some jobs that are so important, we're going to put you in a bubble? If you're the only person who knows how to run the computer program that cuts the checks, we cannot afford for you to get sick. So under no circumstances will you have any contact with the public. 12, how should we compensate those at greater risk? Do they deserve hazard pay? Should we be charging them, charging out sick time against their sick leave or their personal days? Or do we put a moratorium on use of personal days if someone gets sick during the period of the pandemic? 13, may we refuse services to individuals who refuse to follow recommended contagion precautions? What about those citizens who want to come into City Hall and don't believe that they should be forced to wear a mask? 14, what are the ethical considerations that should be taken into account when considering the reopening of programs? This is going to be huge as we start to come out from underneath the pandemic. To extend the question, should we serve those at greatest risk first or those who can congregate most safely? Is it ethical to restart programs with reduced contact or frequency? In other words, some people in your communities depend on what gets offered in the neighborhood centers, what gets offered by Parks and Rec. You know, you may have a variety of programs that target the elderly population in your community, students in your community, whatever the target group might be. As you start to reopen programs, there's a bit of a puzzle here. The safest way to do it would be to open the programs for the people who are going to be safest in those environments. Those who have sufficient insight to maintain control over their own behavior. So they don't shake hands, they don't kiss each other, they don't hug, they wear masks, they wash their hands, right? All of the things they're supposed to do. Those are the safest people to get back into public first because they're most likely not to be either vectors of contagion or, for that matter, recipients of an infection. But at the same time, the people who are most functional and most likely to be the safest as you invite them back into a public space are also the ones who can probably do better on their own. The people who need those public programs the most are probably the people who are less functional, who have less insight, less impulse control. So this is a puzzle. The safest thing to do is to reopen the programs that serve the people who need the programs the least. The ethical thing might be to open the programs first that serve the people who need them the most. But the very people who need the programs the most are probably going to be people who are at elevated risk. So now you're choosing to open higher risk programs before you open lower risk activities. This is an ethical puzzle. 15, how should organizations make decisions about and provide support to employees who are furloughed during the crisis? I know that furloughing is something that people have been dealing with. And so we're going to have to ask a lot of questions about how we manage our workforce moving forward. And my guess is that the furloughs are not going to go away just because rates of contagion are down. The budgetary impacts of this experience are going to linger for at least the next couple of budget cycles, potentially for much longer than that. And so hiring freezes are going to be an issue. and the ripple effects of having a major employer in your locality, which is probably you, not hiring people. Okay, I want to keep moving, and I'm gonna actually run through this very quickly, faster than I thought I might, because looks like you got plenty of great questions. I just want to give you two helpful analogies. I'm gonna do this much more quickly than I thought I would, and then if we desire, we can come back and look at things in greater depth. The first analogy that I want to share with you is based on this slide. I did not make up this slide. Let me explain what it is. I got an ethics consult from a hospital because they were developing a new protocol for response to an active shooter. In the old days, we were always told shelter in place. You go to lockdown. Schools should close their doors, lock the doors. All the students stay in the classroom. Shelter in place when there's an active shooter. The police learned this doesn't work. This is just a recipe for disaster. Most of people are killed in the first few minutes of such an event, and before the police have time to respond. So over the last several years, there's been a change in recommended protocol, and now the mantra is run, hide, fight. Run, hide, fight. First thing you should do in an active shooter situation is run, try to get away. If you can't run, and only if you can't run, hide. If you cannot hide, and only if you cannot hide, remember, you are not Rambo, you are not John Wayne, you are likely to die if you confront the attacker, but if you have no other choice, fight. And they created this slide, which is a little comical because the makeshift weapons here, the syringe doesn't look all that scary. Maybe the scissors are a good makeshift weapon. This guy who's hiding in the hide slide really is not doing a very good hiding. But the people in the run slide are doing a really good job of running. You can tell they're running fast because it's really blurry. And they are running away. There are 4 people in the slide, and they're all running away, and they are doing it at great speed. Here's the problem. This is why I got involved with this. The 4 people in this slide are all wearing scrubs or white jackets. These are clearly healthcare providers. And the PowerPoint that was being used to explain to staff what they should do in the event of an active shooter situation. Run, hide, fight. Someone raised their hand and said, in that picture that you've put on the screen, where are the patients? There are no patients there. Are you saying that healthcare providers should just run away and leave their patients to the danger? I want an ethics consult. So the ethics committee at this particular facility went into a pretty significant policy review, and we did good casuistry, good ethical reasoning. We tried to argue by analogy. What was the analogy? Well, we have already a policy for how we respond to a fire in our building. Do we say run away? No. We say we require of our staff that they first attend to the needs of their patients. Try to get the patients to safety. If you can't do that, then obviously you don't need to lay down your life for no good end. You do get to evacuate the building, but only after you delay long enough to try to help the patients. There clearly is an ethical obligation to help people in your care. And so at this hospital, we changed this slide. We changed the protocol from run, hide, fight to help run, help hide, run, hide, fight. First, you have to help the patients who can run. If some patients can't run, you have to help them hide. Then you get to run, hide, and fight. Why do I share this analogy with you? I think that in the COVID situation, we ask ourselves, what can we reasonably expect from our employees? And what I would argue based on that analogy is, you know what? Some roles do require reasonable levels of sacrifice. Police have to fight crime, and they put themselves in harm's way to do it. Firefighters fight fires, and they put themselves in harm's way to do it. Healthcare providers like home health workers put themselves in uncomfortable situations, and they have to do it. So I think you can say to your staff, no, I declare you essential. We have an obligation to the people who live in our communities to meet their needs. They are dependent on governmental services. We cannot abandon that role just because it's risky. We do have a moral obligation to show up for work. However, we also know by looking at these analogies that we don't expect people to have an unlimited responsibility to help others. There are limits to the responsibility. Police officers are not expected to turn themselves into human shields. We do not expect firefighters to run into collapsing buildings when they know that there's no good that they could do. We don't expect healthcare workers to go provide home health care in a crack house where drug deals are being struck. And furthermore, employers must make reasonable mitigating efforts. Police officers get bulletproof vests. Firefighters get fireproof suits. Healthcare workers get PPE. And I would now argue your employees get PPE. So what do these analogies, and I could give you many, many more, but I want to pick up the pace. What do these analogies show us? You can require sacrifice from your employees. That is part of the job when they go into public service, and this is public service. There are limits to that. You can't expect people to take unlimited risk for minimal gain. And furthermore, you have an ethical responsibility to make reasonable efforts to mitigate that risk, which means that people who don't need to be exposed shouldn't be exposed. So anyone who can possibly telework should telework. Any way that you can reduce the number of contacts between providers of services and recipient services, you should reduce the number. Any way that you can manage the environment to reduce contagion, you have an ethical obligation to do that. You can require that people come to that dangerous environment. But to the degree possible, you need to mitigate those risks. And that will be easier in some work than it will be in others. Social services is going to have a much tougher time of this than, well, I was going to say buildings and ground stuff, but that's already out in public and risky. But certainly there will be certain administrative tasks that can be done completely remotely. All right. I'm going to skip over this next part. This was going to be a review of some of our ethical intuitions about the allocation of resources, because I do believe that much of what we're going to face moving forward is going to be playing out in the budgetary process. And so I wanted to talk a little bit about the values that we could use when we try to determine how to allocate scarce resources. We talk about efficiency, effectiveness, equality, and equity. I could give you various arguments as to what these different concepts mean and which ones should take priority, which are the most fair, which are most ethically justifiable. But what I really want to get to here, and I'm just going to state it, and I'll argue about it later if you want me to, is that the primary value we need to be attentive to here is that of equity, and that equity can be understood as making a decision where the least advantaged person in the story that you've selected, in the outcome that you've generated, is better off than the least advantaged person in any of the other available scenarios. Some of you have seen these equity posters where it shows like little kids behind a fence, and one is a short kid and one is a tall kid, and the tall kid can look over the fence and the short kid can't, but there are some boxes, and you put the biggest box under the shortest kid and the medium box under the medium kid and no box under the tall kid, or the little box under the tall kid, and lo and behold, they all end up seeing over the fence. That's a sweet little picture, but it actually is inaccurate. It is confusing because it actually is a slide meant to be about equity, but it communicates equality. Not equality on input, but equality in outcome. In other words, that everybody's going to eventually get to be the same height and look over the fence. True equity recognizes that you may not be able to guarantee either equality in input, and you may not even be able to guarantee equality in outcome. That is, that it may not be that everybody ends up at the same level because of how you have allocated your resources. Equity is not tied to securing an equal outcome for everyone. Equity is tied to securing the best possible worst case scenario. In other words, the situation where the least advantaged person or group of persons as a result of your choice is better off than the least advantaged person or group of persons would be under any other possible allocation scenario. Basically, in an environment of true scarcity, our goal must be to minimize the harms done rather than maximize the benefits received. When allocating scarce resources, our only concern on the lower end is to satisfy minimum standards of care. There are certain things that we are mandated to do. Once we satisfy our mandates, we need to use whatever discretionary resources we have left in order to maximize the outcome for the least advantaged person, which is minimizing harms, rather than trying to maximize the outcomes for those who are best off, which of course is the concept of effectiveness. Now, the reason that I need to give this to you, even though I don't want to spend too much time on it, is because this gets us to the true ethical issue when it comes to disaster response. What I want to argue is that in a disaster, the normal expectations for how we behave are canceled. or at least displaced. Much of ethics derives from acting consistently with the role that we play. You know, I'm not much on normative theory here, and we've already talked about the first one, utilitarianism. Always act as to bring about the greatest good for the greatest number. That was from a question before. I implied, or I mentioned briefly, deontology as a response to that. Always treat people as ends in themselves, never as means only. That's rights theory. Here's one theory, however, that I think matters when it comes to disasters. Aristotle's virtue theory. The idea here is that I can know what I can reasonably expect from you when I understand what role you play and what relationships you have. Define for me, tell me the story of who you are, what you do. You are a county administrator by virtue of the fact that what's the essence of being in that role, in that job? What's the characteristic activity? What makes you one of those things? It's not just that you have initials after your name or that you get paid by a certain locality. It's that you view your role as satisfying a set of goals and a set of standards of practice, such that if you do those things well, you will be a good one of those things. You'll be a good administrator. If you do those things poorly, you will be a bad one of those. If you don't do them at all, even though you have the initials after your name, you just won't be one. This is an important theory for our current purposes because it pulls up some intuitions that I think are very, very valuable here. We need to act consistently with the reasonably understood standards of practice for our roles. And what I want to argue is that what makes a disaster is that all changes. The Greek word for this role that you play, this essence that you satisfy, this virtue, notice how the word virtue is used differently than it might otherwise be used, that this virtue that you evince, the Greek word is the arete. And what I would argue is that in a disaster, we need something called disaster arete. The reasonable expectations for your behavior shift. It's disaster arete. I mentioned disaster arete once in a speech that I gave, and someone said, gee, it sounds like a ballet move gone wrong. Yes, it's balance that gets thrown off because of a context. I believe that there are altered standards of practice for you right now that COVID-19 has already generated. Expectations for the general delivery of services have to change. People cannot expect that they're going to get what they've always gotten. Your prioritization in your budget process is going to have to change. You're going to have to reshuffle your priorities. So the disaster has generated a different expectation for how you will behave as you manage your budgets. Even things like public meetings and transparency. Have you found a way to continue to conduct business consistent with FOIA that seizes opportunities for alternative communication? How are we going to manage the distribution of information in a world where we can't meet face-to-face in a room? And freedom of commerce. What are we going to do about opening and closing of restaurants and businesses, and how many people they're allowed to have inside, and whether or not people are going to be required to take precautions? These are questions that fundamentally alter the standards of practice, and we need to communicate about this. Disaster ethics requires that we communicate clearly about a number of things. Otherwise, there will be a mismatch between expectations and delivery. And I believe that the vast majority of ethical problems emerge when there is a disconnect between what people reasonably expect to receive and what we reasonably believe we can deliver. So communication is clear. We need to communicate about who has the authority to declare that we are in a disaster situation where altered standards of practice will apply, where expectations must be adjusted. We must communicate clearly about what is expected from our staff members during this period of time. We need to communicate clearly to all of the interested parties, to all of our stakeholders, what can they expect and not expect during this disaster? What is going to change for them? We need to communicate clearly about how we will invoke concepts of collective responsibility for what happens here. It gets back to that question that was asked before. Are we just going to get into a finger-pointing blame game where the press gets extra ratings because they're making a kerfuffle out of something that they shouldn't, where politicians get to have an upper hand against the competition, where someone just gets to say, you know what, it's just not my fault, so leave me alone. We need to talk more about how we will invoke a sense of collective responsibility, not for the fact that we're in a disaster, but how we are going to manage ourselves during the disaster to mitigate the harms. And then, of course, we need to communicate clearly about when this disaster is going to be over and when we're going to be able to revert to our typical standards of practice. When will people be able to go back to expecting from local government what they always used to be able to expect? And that is not going to come the day a vaccine is rushed into production. So we now have an opportunity for questions, comments, and arguments. It looks like I've left about a half an hour. What I'd like to do, Tim, before I have you open your microphone and hit with some questions, is I want to share with you just some cases that I've come up with, and just so you can see what the array of issues might be, and I'm sure you have some that I haven't even thought about. First one, I call it Scylla and Charybdis. Those of you who like Homer will recognize that. You also might, if you don't read Homer, read that as between a rock and a hard place. I'm not going to read all these. I'll just describe to you what it is. You have a council member who is not a council member. You have council members who are agitating for some change here. It might be easiest if I just read it. As the number of coronavirus cases increases in the state, your locality has fortunately seen only a moderate number of illnesses and no deaths to date. It is time to open the public pool for the summer and prepare the neighborhood centers for summer programming. You're very concerned about the risks associated with public gatherings, so you want to keep the pools and neighborhood centers closed in order to protect the health of children and their families. Your police chief is very concerned, however, that without an outlet for youth to expend energy in a healthy way, the crime rate will increase over the summer. You're faced with having to weigh health risks caused by COVID-19 against health risks caused by insufficient supervision of young people, should you open the city's recreational facilities. Second case, in response to an identified incidence of COVID-19 cases in your locality, you've requested that all people enter council chambers, all people who do that wear face masks and maintain physical distancing. One council member denies that coronavirus pandemic is as bad as the cable news outlets have claimed, and he demands a public hearing to discuss the manager's recent decision to close public recreational facilities. This council member refuses to wear a mask himself, and he has recruited dozens of citizens to attend the hearing in council chambers without wearing PPE. Several staff members have indicated their discomfort at having to attend to this meeting in such a closed space and have asked to be excused from the session. Do staff members have a right to refuse to attend high-risk meetings in service of council? Next case. The county has determined how it would like to utilize federal funds received under the CARES Act. But your town, which is located within the county, has identified a variety of high-priority opportunities for use of those funds that have not been included in the county's allocation decisions. As a town, you do not have direct access to CARES Act funds, so you petition the County Board of Supervisors to distribute a proportionate amount of its funds to the town council so that it will have the opportunity to exercise its spending discretion. Does the county have an ethical obligation to pass any portion of the available funding to a town within its jurisdiction? I admit I wrote this slide in ignorance. I was told that this is the case, that the allocations are going to the counties and that towns don't have direct access. I apologize if that's incorrect or if there's more detail to this, but I would love to discuss town-county relations as a result of the pandemic. Next case. Prior to enacting furloughs for staff whose positions are no longer active during the pandemic response, you were careful to contact all members of your local governing body. Everyone seemed to understand that the pandemic was causing significant budgetary impacts and that some services which were not essential would need to be limited for the foreseeable future. After having these conversations, you took the step of furloughing the identified employees. At the next meeting of the governing body, one member publicly wondered aloud about how such thoughtless bureaucrats could be so insensitive as to lay off people in the midst of an economic downturn. You feel completely blindsided by this comment, but you are unsure how to respond, especially since the cameras are rolling. I absolutely understand, and I actually appreciate, from being on the other side of the dais, the fact that you all are committed to not embarrassing your elected officials in public. How do you respond when they embarrass you? Especially when they had every opportunity in advance to voice their concerns and to at least warn you that they were going to bring up an issue, but instead decided to go for the big splash. Two additional cases that are not specifically pandemic related, but I want to read these cases as well. Subsequent to the death of George Floyd, demonstrations in support of racial justice and against discriminatory policing tactics have ignited intense controversy in your community. One demonstration recently became violent, causing minor injuries and significant property damage in a specific neighborhood. Plans for continuing demonstrations are underway, and there are threats of riots. The demonstrations are in identifiable areas. The police chief has asked the manager to institute a curfew. 1, should a curfew be used as a means of managing potential riots? 2, if so, should the curfew be a blanket order for the entire locality, or may it ethically target a specific geographic region? And 3, under what conditions should the curfew be lifted? Pretty straightforward questions. Last case to share with you. While demands for police reform have swept through the nation, local demands for change have taken on a specific character in your own community. Your police chief is a white male, and he has had an exemplary career without blemish, but he has not been particularly proactive regarding the development of diversity within his senior staff. County Board of Supervisors believes that it is important to demonstrate a commitment to diversity and inclusion policies, and a vocal minority of supervisors, so I want to just point out that you haven't gotten a majority vote yet to do this, but as a whole, the body is in favor of a commitment to diversity and inclusion, and there is a vocal group amongst your supervisors demanding that change can only come from the top. This group now demands that you fire your current police chief in order to hire a person of color for that position. How should you handle this request? So those are all of the cases that I have brought, and I am happy to ignore them all and respond to your questions, comments, and arguments. Because I, of course, love nothing more than getting a good argument going. So I probably believe a little bit more than half of what I've just said. Tim, you may unmute yourself and hit me with some questions. We've got about 20 minutes left.
Okay, we will we'll back up a little bit to earlier in the presentation. The next question we had was, since we are living and working in a time of disaster, how are we helping or hurting community through past action, policies, and procedures that may no longer be viable to the community?
Okay. I think I honestly do believe that what we're seeing across the country with regard to the demonstrations for racial justice, demonstrations about a history of discrimination in this country that has been devastating to people of color, to a variety of different minority groups, a variety of different demographic groups. I don't think this is just a question of race. I think that it also impacts the LGBTQ community. I think that religious discrimination continues to be an issue in ways that maybe many don't even recognize. And of course, economic disparity continues to be a problem that also tracks along racial and national lines. I believe that all of that actually is not accidentally playing out now during the period of the pandemic. I think that the issues of the pandemic and the issues of this social unrest are connected in important ways. And I don't think that they're just connected because people are frustrated, they've been inside so long, and they're just, sort of their patience is tried because they're worried about their jobs, or they're worried about whether or not they're going to get sick, or they're just sick and tired of staying home. I don't think it's that simple. One of the things that we have seen as COVID-19 has progressed is an disproportionate impact on minority populations in our communities. The number of people who are getting sick, if you look at communities of color, if you look at racial minority populations within our society, the number of illnesses is much higher in those communities than the base rate generally. The number of deaths per illness are also higher. So it's not just that more people, say more African Americans get sick and therefore more deaths accrue in the African American community. It's true that African Americans are getting sick with COVID-19 at higher rates than the base population. But it's also true that even among that the per capita sickness to death rate is a higher conversion rate among African Americans than it is among sick white people. Well, why? Why are we seeing this? It is not simply a question of, gee, there must be something in the genetics of this virus that attacks certain populations more than others. There doesn't seem to be any scientific evidence to indicate that this is in any way a trait that is linked, a genetically linked trait that makes you more susceptible to COVID-19. What seems to be true is that the pandemic is revealing, not causing, but revealing the vast disparity of health opportunities in our communities along racial lines. That the social indicators of health, your access to a cheap and healthy food supply, your general levels of stress and tension from the time you're growing up, how safe do you feel in your communities, and how much stress do you grow up just feeling? That has lifelong health impacts. Are you gainfully employed so that you can afford things like food, but also relaxation, and that you have a good relationship with a primary care physician whom you see on a regular basis, who knows your history, who can identify issues early in their course when they arise? There are what jobs are you in? Are you in jobs that require of you close contact with other individuals who might, at higher risks than the background rate, carry the COVID-19 virus? There are all sorts of social determinants of health that we now can see, and we should have seen. Many of us did see it. Many of us didn't. Many of us saw it and didn't care. Some of us just weren't listening. But this whole experience has revealed, not caused, but revealed the depth of disparate opportunity and impact in our communities based on racial identity. And some other, and so, as I said, there are other groups also that are systematically disenfranchised, systematically discriminated against. I don't even think it takes a George Floyd. In fact, in some ways, and I know I'm going to get attacked for saying this, those are the easy cases. When you see someone overtly do something so egregious, yes, it can cause a national response. But in a sense, that's the easy case, because you can point to the offender and you can describe what they did, and you can say, I disagree with that, and you can say that was wrong, and you can feel good about yourself because you're not a racist, because you don't think that George Floyd should have died that way, and you think that that officer was using unreasonable force. So that just goes to prove that one bad apple, it only takes one bad apple to spoil the whole bunch, and damn it, that police officer was the one bad apple, but I'm okay, and my systems are okay. Come on, guys. Come on. The reason George Floyd was the one on the ground, and the reason that the officer was the one with his knee on his neck, was not an isolated exchange between that officer and George Floyd. It is a symptom of generations of disparate opportunities, of disparate behavior, of differences in feeling whether you're enfranchised and have opportunity or not, of stress, of strain, of segregated neighborhoods, whether they're legally segregated or just that's the way we do it by fiat. This is a very, very, very deep problem. I hope, and this is a very long answer to what was a relatively short question. I hope that we all, without feeling as though we need to take personal responsibility for every bad thing that ever happened in the past, I hope that we can take personal responsibility for not having done enough to recognize the sins of our forefathers, and that we can dedicate ourselves to recognizing that we need to move forward. I think the pandemic will pass, but the lessons of the pandemic will be with us until we use this as a transformative moment. The politician in me just took over the ethicist in me, and that was more soapbox than ethics. So, but I think we need to own up to the fact that no matter how hard you think you've tried, there are systemic issues in your community, and part of the rejiggering of our budgets might be that we need to put a higher priority on facing those problems and trying to make progress. I just see something came up. Do you have any recommended readings on these topics? Actually, I was just in a panel discussion. I wasn't on the panel. I was attending a panel discussion online just the other night. It was at University of Lynchburg, and it was an interesting panel. But as a result of that panel, they asked exactly that question, and then they emailed out a syllabus of some books to read about recognizing racism and how to be an anti-racist, or how to no longer be racist. Some podcasts, some videos. I will make an effort to forward that short list on to the organizers of this conference. And if anyone wants to do some reading on that, I think it would be wonderful. Tim, do we have another question?
Yeah, I think you touched on a lot of this, but we'll ask it anyway. It says the locality has historically disadvantaged a group of people on the basis of their race through public policy and law. Please discuss the local government's ethical obligation to redress that history with new laws and policy to advantage that group.
Well, of course, answering that question in any specific detail would require that we have a conversation about the policies to which you refer when you talk about the history, and also that we talk about what the policies are that you are contemplating invoking in the future. This does get a little bit back to the equity question that I mentioned before, and I want to point out I just caught a quick glance about my question of equity, or my claim about equity, and the question was, well, says who that this is what equity is? How about maximizing the outcome for as many possible rather than for just those who start off as least advantaged? The question is a good question, but it misunderstands my answer. I never said that we should engineer a situation where we meet the needs of those who start off as least advantaged. What I said was that we need to engineer an outcome where whoever ends up being least advantaged is least advantaged less than whoever would end up being least advantaged in any other possible circumstance. So in other words, what we're trying to do is make sure that if we have people at different strata of welfare, that the person who's at the greatest risk is still better off than the person who would be at greatest risk if we were to choose a different allocation scheme, so that we've engineered a circumstance where the people who are most challenged in our community are still less challenged than the people who would be most challenged in some alternate community. So it doesn't matter where you start. What matters is where we're trying to end up. This is an important concept because it's going to force people who are at the top to recognize that if it's necessary for some people who would really benefit at the top to forego some of what they could have in order to elevate the welfare of those who are least advantaged, provided that it does not result in a situation where they then become even less advantaged than the other, well, that's a fair trade, that it's perfectly ethical to say, if I have $5 to spend, and let's say there are two people in my community who are relatively situated in terms of their welfare, whatever it is we're distributing, opportunities, jobs, whatever. There are two people who could receive that good. If I give it to this person on the top, they're going to get, with my $5 worth of investment, they're going to get $20 worth of benefit. It's going to be magnificently effective. We're going to leave this person right where they are, but boy, the winner wins big. If, on the other hand, I were to spend the $5 that I have on this person or on this program, and we're only going to get $2.50 worth of benefit, this person's going to rise from here to here. Well, it's not particularly efficient because I spent $5 and I only got $2.50 worth of benefit, whereas if I spent $5 here, I would have gotten $20 worth of benefit. It's not very effective because the guy who wins, would have won much bigger if I had given it to the guy on top. It's not equal, clearly, because I'm spending it on one and not on the other. I'm not giving $2.50 to you and $2.50 to you. No, what I'm choosing to do is to spend the $5 on this person to elevate their circumstances. This person's going to have to forego their $20 worth of benefit because I then end up in a situation where the person who is best, this person isn't made any worse off. So it's not like they drop way down. They stay where they are. This person benefits. There's no one below them who could benefit from the expenditure. I've now elevated the status of the least advantaged members of our community. That's a deeper understanding, and believe me, I got slides. We could spend hours just on the concept of equity, but that's a concept of equity that needs to inform your budgeting decisions. And it might mean reallocating resources from programs where people do benefit, no question, but they benefit on the upper end. And if we reallocate those resources, we can adjust the benefit on the lower end. That is fundamentally an ethical question. And I do want to say this, early on in the introduction, your illustrious leader said that budgets are fiction. Well, to some degree, yeah. I mean, they're working documents and they're aspirational and they're not necessarily meant to always fall out exactly the way that you plan. But I want to argue that your budget is fundamentally the most ethical document you have. What I don't mean is that it is an ethical budget, because it might not be, for all I know. What I mean is that if I really want to know what you care about, I mean, you can tell me constantly. You can tell me what you value. You can tell me how invested you are in creating new opportunities and fighting all the sorts of discrimination that we've inherited from past times, and that is so important to you, that you value that. If I really want to know what you care about, I'm going to look to see what you spend your money on. Where you put your money is what you actually care about. And so if you are not putting your money into supporting the kinds of community dialogues, restructurings, programmatic opportunities that you, based on research and discussion with your community, it's going to take a lot of community input, that you believe is going to move the needle on all of these deeply divisive issues, then you can say you care about it, but at the end of the day, I just won't believe you. Do we have time maybe for one more, Tim?
Yeah. So the next one was, what are our obligations to our employees who don't want to telework? My office workers have the option, but prefer to work in the office, even though they are high risk. Excellent.
I would tell them no. One of the mistakes we've made during this pandemic, I don't know who made this mistake. We all don't make this mistake, but one of the things that's out there that I think is mistaken and is dangerous is that when people talk about the risk of getting sick, they unpack that as a liberty question, and they make an argument along the lines of, who are you to tell me how much risk I'm allowed to accept in my life? I'm a risky kind of guy. I like skydiving. I like rock climbing. And who are you to tell me that I have to wear a mask? If I feel like I am willing to, I'm a young, healthy guy. I don't think it'll be that bad if I get it. I don't even think I'm going to get it. It's a massive government overreach for you to tell me that I need to be careful. Who are you to tell me how much risk I should be willing to tolerate? That is absolutely wrong. That is just completely misunderstanding the circumstances here. I was in a store the other day, and I have to tell you, I have gone into a store maybe 3 times in the last 3 months. I have been very, very careful. I'm happy to be able to telecommute. And I was wearing my mask, and the person working in the store was wearing a mask, and I thanked him. Actually, I think I was with my wife, and my wife thanked him and said, thanks for looking out for us. Thanks for wearing a mask. And this was after the governor had gone to the phase where we could reopen, but we required people working in stores to wear masks. And he said something like, yeah, well, I was told, my boss said I had to do it, but I think it's stupid, and I just don't like people telling me what I have to do. And I felt like responding. I actually was more polite than I needed to be, but I felt like responding by saying, oh, so what, you drive on the left-hand side of the road? You ignore speed limits? You don't think that, you should have to have a driver's license at all? Like, you don't like people telling you what to do. Like, driving on the right-hand side of the road really, really, really bothers you. Like, that is a core, fundamental liberty, like, call out the militia. I can't believe they make me stop at red lights. Come on, people. Nobody thinks that. Nobody thinks that. Everybody recognizes that the reason you drive on the right-hand side of the road and the reason why you have to stop at a red light is not just because I'm telling you how much risk you're allowed to take. I don't tell you you have to drive on the right-hand side of the road because I'm telling you you should not want to get hurt in a car accident. You want to get hurt in a car accident, go off-road somewhere and drive yourself silly. What I'm telling you is you cannot put other people at risk. It is unethical for you to decide for someone else how much risk they are to accept. So if you're going to tell me that you don't like government telling you how much risk you get to determine you want to take, then who are you to tell everybody around you how much risk they should be willing to take? You're not putting on a mask to protect yourself. You're putting on a mask to be polite and to respect the rights of everyone around you. So if you don't want to wear a mask, stay home. If you can do your job in a way that doesn't put other people at risk, as your employer, I'm going to require that of you. You don't like it? Get another job. I don't think that's ethically difficult at all. I think 100% of the people on the providing side of the table need to be wearing masks. And I think anyone who can do their job without being in an environment where they need to potentially bring contagion into the workplace ought to be working from home. And we're going to phase that out. I mean, as facts on the ground change, we're going to have to recalculate the cost-benefit analysis. There's a cost associated with working from home. There's a benefit associated with working from home. As the risk of contagion goes down, then that cost benefit changes and you might call some people back into work because they can be more efficient by doing their work at work. At the same time, however, if we get wildly comfortable with these sorts of platforms, the efficiency of working from home is also going to go up, which means, and I predict this is true, we're never going back to the way it was. Some of your folks who are working from home now will have to come back to work because they will be far more efficient in the workplace. But they're not going to have to come in 8 hours a day. They're not going to have to come in 5 days a week. And some of them may never have to come back. There's going to be a new model of how work gets done. And think about how much money you might be able to save. Maybe you need to build a building with half as many offices. Maybe you can shut off power and air conditioning to half your building because we will develop a new workflow that does not depend upon geographic proximity. Tim, I think I've exhausted my time. I'm going to mute myself before you all mute me and let you or whoever else it is who wants to do it take us on out. The last thing I just want to say before I do finish this is I hope this has been an interesting conversation. You know I am open to criticism, so I would love to continue this argument by other means, but I just want to end by saying many of you are doing things that absolutely, all of you are doing things that have to get done at this challenging time. You are putting yourselves in harm's way. You are showing up for work as the leaders in ways that create risk. You are demanding things of the people who work for you in ways that I'm sure is burning in you a big old ulcer, and you are concerned about your communities. I understand how hard this is, and I just want to say thank you for not running for the hills, but for demonstrating the kind of courage that we need. And I do want to echo some of what Jim said before. Maybe that is a symptom of the manager-council form of government, where council members don't have to worry about the political implications. I'm sorry, council members do have to worry about the political implications of the stands they take, but you are a little bit freer to really try to just do what's right. And I know it's hard, and thank you for your work.
Dr. Gillette, we thank you so much for being with us today and going over these issues that we are dealing with each and every day during this pandemic. And it was a great discussion, lots of good questions. There are a few other questions out there that folks asked we didn't get to, and we apologize for that. But it was a great discussion leading us to lead us off here with our summer conference. And we really thank you for spending that time with us and giving us your insight into that.